It's sort of a life-changing incident because 2 minutes prior I was flying down a hill. All of a sudden, in an instant, my shoulder was sitting in front of my chest and I couldn't walk. You know, I'm happy that I was able to have a procedure and fix the problem that I have.
I mean, I was at the point where if I was at a table with someone and they asked me if we had wine at the table, you know, to pour them a glass of wine, I could not pick a bottle up.
I couldn't pull my pants up. I couldn't comb my hair. If I just sat perfectly still, I was fine. I'm not that kind of person, and I don't want to sit perfectly still for the rest of my life. So my life now is so much happier.
Today in orthopedic surgery, and in particular with shoulder problems, there's no reason to accept pain, chronic pain, or lack of function. We have so many beautiful tools to turn this around and to restore you back to normal.
The AC joint looks perfect here, and it allows for patients to recover much more quickly with less pain.
Over the past 20 years, our understanding of shoulder conditions has really exploded. So we understand the science better, the biomechanics better, the surgical techniques have improved. We become less and less invasive for many conditions. I'm one of the people that brought reverse shoulder replacement to the Bay Area in 2004, and it has been a remarkable intervention for us as shoulder specialists today. So a little bit of pain is routine for the first couple of days. So
one of the greatest honors you can have as a physician is taking care of another physician or a family member of a good friend or colleague. Dominic Curatola had a massive, recurrent, irreparable rotator cuff tear involving multiple tendons of the shoulder.
Initially, I was actually looking at a gentleman who was at the Stedman Clinic, who coincidentally trained at Mass General with Dr. Costoris years ago.
Hello, Dr. Curatola. How are you?
Doctor, how are you?
I'm going to shake your left
I
hand.
can't give you my right.
Soon to be your right hand. How are things going since surgery?
To me, it was a blessing. I remember speaking to him on the phone, being grateful that I was able to see someone of that level of expertise who was in my backyard, and that I didn't have to sacrifice quality or excellence. You know, in medicine, it's the finest compliment when one of your colleagues choose you to be their physician. And it's the ultimate sign of respect, not only in terms of your skills, but trust in your abilities. And I think as a patient, there's nothing more important than feeling cared for.
So this is Dr. Galami's post-operative x-ray, and he had a grade 5 AC separation.
I was flying down the hill and my left ski got grabbed by a branch, and it basically grabbed my leg and it tossed me into a rock. I hit my shoulder with a rock, and I knew something had happened. Ski patrol came, put me on a toboggan, went up to the emergency room. Lucky enough that I'm in the medical profession, and I called one of my close friends who's a shoulder surgeon, and she had recommended Dr. Costeros. 3 days later, I drove back from Lake Tahoe, went to Washington Hospital, showed up in the morning, had surgery, and went home. So I'm a urologic oncologist. I do minimally invasive robotic surgery. I rely on my hands to be able to operate on people. I was a little bit depressed. I mean, everything that I do revolves around the use of my hands, whether it's surgery or it's anything that I do. And so not having the use of my right hand kind of was hard. And after surgery, I mean, Dr. Costeros kind of reassured me that things would go back to normal and it would take time. Surprisingly, it's taken a lot less time.
About a year ago, I fell at the post office and I fell on a little board, just a weird little accident, and down I went and broke 3 bones right in here. So I started to go to physical therapy and did everything that the doctors told me to do. Nothing was getting better. So they said the only thing that we can think that you could do is have a shoulder replacement. And they recommended Dr. Costoris, and that's how I ended up with him. They took excellent care of me at Washington Hospital. Very little pain at all, and the next day I went home. I feel great, I really do. I did not realize how much pain I was in until you're out of it.
Excellent. You're doing great.
What makes the Institute for Joint Replacement Research unique, it is entirely devoted to joint replacement surgery, from nursing to therapy to physicians that perform a high volume and who are experts in these particular procedures. The consumer and the data and publications have proven that areas that have high volume surgery perform better. Outcomes are better, complication rates are less, recovery is faster. That is what makes Washington Hospital unique.
Learn more about shoulder replacement at BayAreaHealthierTogether.com.